Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board-certified family medicine physician specializing in urgent care. I assist busy professionals to find solutions for their acute and chronic medical needs. I do this via my telemedicine platform, via my COVID-19 testing, primary care, via my brand new Amazon best-selling book, Vitality, as well as through my concierge medicine program. So good afternoon, ladies and gentlemen. We're a little late getting started with you today. We apologize about that. We had some technical difficulties, but excited about today's topic. One of the things that we talk a lot about are the benefits of vitamin D. This is something that I had a conversation with a friend of mine from CBS News, Andrea, about off camera, about the benefits of vitamin D. This is something we've talked a lot about, you guys. If you've been watching over the last several months or even over the last year, it's something that we talk a lot about. So let's talk about why we keep talking about vitamin D. What is vitamin D? Okay, so what is it? Vitamin D is known to be the sunshine vitamin. It's produced in your skin in response to sunlight. In other words, your body produces vitamin D naturally when you're exposed to sunlight. So the first question everyone asks always is, how much sunlight do I need? So typically about anywhere from 10 minutes to 30 minutes, depending on your skin tone, of midday sunlight is what they typically recommend, at least 3 or 4 days a week. People that have darker skin, it may take you on the higher side of that window. If you are going to go out in the sunlight, though, we definitely want to make sure we wear a sunscreen with at least 30 SPF and that sun protective factor. So that's why we naturally get vitamin D. So next question is, what does it do? Vitamin D is the sunshine vitamin. It helps your body absorb calcium and phosphorus. And calcium and phosphorus are very important. Almost all the calcium that you have in your body is stored primarily in your bones and in your teeth. We also need calcium to help with the muscle movement. Phosphorus helps with the formation of bones and teeth as well. So we also know that vitamin D helps to facilitate normal immune system function. So having an adequate vitamin D level helps in that nature. There are a few other things that vitamin D does, but that's what we're just going to focus on today. Now, let's talk about what most people want to know. Hey, what are some of the signs of vitamin D deficiency? If a person is deficient in vitamin D, how would they know that? How would they feel? Everyone that has a vitamin D deficiency will not have symptoms. Okay, that's the first thing. Secondly, some of those signs or symptoms could be, so if you're having these symptoms, you want to make sure that you have an adequate level of vitamin D, and you'll discuss that with your physician, and they will have you come in and check your blood and all of that. So bone loss is one of the signs or symptoms, bone and joint pain, fatigue, mood changes, as well as muscle cramps. So next question, what is the adequate amount of vitamin D that we need to have daily? Adequate amount for a typical adult, anywhere from 600 to 800 international units. Now, let's talk about one of the reasons, before we talk about where we get vitamin D from. Let's talk about why are we talking about vitamin D right now? Why is that so important to talk about right now? There have been studies, specifically that I followed at Boston University School of Medicine, where they studied a group of patients that were COVID positive, and found that the patients that had adequate vitamin D levels of 30 or higher, which is typical in most laboratories, had a decreased risk of adverse clinical outcomes, such as, number 1, being unconscious, number 2, suffering with hypoxia or decreased oxygen in the tissues, and number 3, death. So that is what the study that Boston University School of Medicine found. There's another study, and most schools of medicine are studying this. And these are just some of the published studies that I have had the opportunity to read. The University of Chicago School of Medicine did a study specifically about vitamin D supplements. And they found that people that have a history of using vitamin D supplements in the past, or making sure they have adequate vitamin D, had a history of decreased risk of viral respiratory illnesses. So higher risk of vitamin D deficiency are seen in certain groups and populations. We do know that African Americans and Hispanics who have a darker skin tone tend to have a higher level, or higher percentage rather, of those cultures having a vitamin D deficiency. In addition to that, people that live in northern cities like Chicago, New York, less sunlight exposure. Therefore, it makes sense. We already talked about the fact that our bodies naturally create vitamin D once we're exposed to sunlight. So those people that live in places that have less sunlight exposure, no surprise there that they could struggle with or be challenged with vitamin D deficiency. So definitely want to make sure we pay attention to that. There have been several studies in addition by several other universities that have shown that people that have an untreated vitamin D deficiency are more likely to be positive for COVID-19. So, next question. We know how important it is. We know it helps our immune system to facilitate our immune system in helping those cells that help fight off infection. We know that it helps with muscles. We know that it helps with calcium and phosphorus absorption. In addition to that, we want to find out, okay, where do we get it? Naturally, we get it from sunlight. We talked about that. I want to talk about 3 of my favorite natural food sources for vitamin D. Now, the first food source I want to talk about, and we talk about the benefits of this food all the time, and that's salmon. Salmon has a wide variety of benefits, including having antioxidants. The one thing we want to highlight today is that typically in one serving of salmon, you have at least 526 international units of vitamin D per serving. And we talked about 600 to 800 international units needed daily for each adult. So if you're eating salmon, you are winning for several different reasons, but definitely in terms of your vitamin D level. Second food I want to talk about today are mushrooms. Mushrooms are known to contain antioxidants that help protect from free radicals. Free radicals are things that help to lead to things like heart disease and cancer. So mushrooms synthesize vitamin D when they're exposed to UV rays. The amount of vitamin D you can expect with most mushrooms, typically about 130 to 450 international units. Third food we want to highlight today, egg yolks. And we have to be careful with egg yolks in talking about cholesterol, but here we want to talk about the benefit that they serve in their vitamin D amount, or the amount of natural vitamin D that you can get. Egg yolks provide a boost of antioxidants. They contain calcium, cobalamin, as well as vitamin D. One egg yolk is known to also give you 37 international units of vitamin D. So, with that, one of the reasons we wanted to talk about vitamin D today is because it is a gorgeous day outside here in Birmingham, Alabama. Beautiful opportunity for you to get your intake of vitamin D for today. So make sure you sunscreen first. We're going to do that with at least 30 SPFs, or sun protective factor, of sunscreen to help protect us, because we do know that you can get skin cancer. You're at risk of skin cancer when you spend time in the sun. So we want to make sure we wear that sunscreen, very important, and then go out and grab your vitamin D naturally. So thanks for tuning in. That's all we had to share with you guys today. Some of the benefits of vitamin D. We'll continue to highlight this and the reason why we talk about it so much. If you're wondering, hey, am I someone that needs vitamin D, or you're concerned about it, or do you have any of those symptoms, definitely contact your physician and find out, hey, when was my vitamin D level last checked? Is this something I need to be concerned about? And definitely, if you're someone that has been COVID positive, I definitely encourage you to make sure that you have your vitamin D level checked. So hope everyone gets out today and is able to get an adequate amount of vitamin D. Thanks for tuning in, everybody. Hi, Miss Womack, Miss Lindsay, Miss Robinson, thank you for watching. My husband's watching. Hey, babe, how are you? Thank you for watching. As well as Miss Merritt. Hi, Miss Merritt, how are you? Good morning. So, hope everyone has a happy Sunday. Get out and enjoy this vitamin D. Thanks so much. Now, if you're in need of COVID testing, we're continuing to provide COVID testing at Legion Field. Definitely look at the website. You can make an appointment on the website, or you can call us and we'll make the appointment for you. The website is drceleste.c19.com. That's drceleste.c19.com. Or you can give us a call and we'll be more than happy to make the appointment for you on our COVID line. That's 205-543-2684. That's all we had to share, everybody. Thanks. Have a good day. Bye-bye.